It's time to get rid of the biggest con job in healthcare. Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. 35 states and Washington, D.C. have what are called Certificate of Need laws, CONs, that for decades have done real harm to healthcare quality and costs. Cons require government permission to build new hospitals, clinics, and other medical facilities, or new services, or to expand existing ones. Does a hospital want to add a burn unit? Got to get a con. Want to construct a hospital where there's one overcharging patients? Good luck. No surprise, cons restrict competition and promote regional and local monopolies, which means higher prices and restricted access to medical care. After all, approval boards are often loaded with personnel tied to existing facilities. It's like a panel with people from McDonald's passing judgment on an application for a new Wendy's. To obtain a certificate of need is not cheap, what with unavoidable outlays for lawyers and consultants, not to mention unnecessary time delays. Cons are costly. The Kaiser Family Foundation found that states with con laws have higher health care costs than states that don't. A study from the Mercatus Center at George Mason University confirms that con law states have fewer hospitals, fewer hospital beds, and fewer ambulatory service centers per capita than con-free states. An examination by the Americans for Prosperity Foundation discovered that North Carolina's con law cost the Tar Heel state at least $1.5 billion in proposed capital expenditures between 2012 and 2022. Amazingly, in 1974, Congress forced states to adopt Certificate of Need laws, ostensibly to avoid duplication of medical services and somehow improve medical care. If a state didn't comply, it would lose federal funding. Cons did just the opposite of the stated intentions. In 1987, Congress repealed the con mandate, giving states the freedom to junk or change their laws. 15 states have done just that, thrown those con laws out. But 35 states have variations still in place, although several have modified them. Florida, for instance, has removed or pared most of the healthcare industry covered by its con law, but rehabilitation centers and hospice services have yet to be liberated. Congress should, but won't, do a 180-degree turn on that notorious 1974 con mandate and declare that states that don't eliminate them will lose federal funds. But instead, citizens and local groups should demand their legislatures get rid of all con regulations. I'm Steve Forbes. Thanks for listening. Do send in your comments and suggestions. I look forward to being with you soon again.